welcome to another interesting and educative episode of the Global Health Pharmacist Podcast. Today is the first episode in the series called Global Health Conversations with PharmG, and I'm excited not only about the topic of today's discussion, but also about the very important personality I have on the show to discuss it. Today's episode is all about one of the most pressing conversations of our era. While the world has moved on from the height of recent global health crisis like the COVID-19, the work behind the scenes to prevent the next one never stops. We are going to learn how to prevent the next pandemic and also break a particular myth about pandemics. I hope you are excited for all of this and more, which you'll be learning on today's episode. I'm thrilled to introduce our guest, a leading voice in genomics and infectious disease, the co-founder of SENTINEL, an early warning framework designed to detect pandemics before they spiral out of control. He also leads a cutting-edge research institute dedicated to advancing global health security through innovation and collaboration. He is one of Time 100 most influential people of 2025. In this conversation, we will dive into how genomic sequencing can help us spot emerging threats, what lesson we must carry forward from COVID-19, and how frameworks like Sentinel can empower countries, especially those with limited resources, to stay ahead of the next outbreak. We'll also explore the role of individuals and communities in preparedness. Without further ado, let's get right into it. Joining me to discuss the topic pandemic preparedness is Professor Christian Happi, Distinguished Professor, Reedemer University, Adjunct Professor, Harvard T.H. Chan School of Public Health, and Director, Institute of Genomics and Global Health, a true pioneer in the fight against infectious disease and a visionary in pandemic preparedness. Welcome to the Global Health Pharmacist Podcast, sir. It is an absolute honor to have you on the show, and thank you for joining me in today's discussion.
Thank you. It's a pleasure.
Yes, sir. So, let's start, sir, with this basic question in order to help our audience understand the topic more. Sir, what is the difference between a pandemic and an epidemic? Or should I say first, what is your definition of a pandemic?
The pandemic is a disease that starts somewhere and spread worldwide. That's what we call a pandemic. Pandemic is a disease that starts locally and then eventually spread. When it spreads, and it's a disease of public health that is spread across. And then when it's a disease starts locally and then spread across, an epidemic is rather a disease outbreak that remains localized in very vast
Okay, sir. So if I get you right, sir, a pandemic is a disease that spreads across borders, while an epidemic is localized.
Yes.
Yes,
pandemic
sir.
is across the board. When you say you can have an epidemic that happens with you. But when you talk about pandemic, it's something that's from worldwide.
Okay, pandemic occurs worldwide. All right, sir. Thank you, sir. So how do you define pandemic preparedness in today's global health landscape? And how has the definition evolved since COVID-19, sir?
So global health landscape is the ability of what I would call countries and global health institutions, so public health institutions, to come together preventing that across the world. That framework requires people to cooperate. That framework requires collaborate. That framework requires countries to report, epidemic or disease outbreak as soon as they reach. That framework requires what I call partnership. And then address epidemics or local outbreak as soon as they start to prevent, this spread and become But it also, pandemic preparedness requires education, pandemic preparedness requires infrastructure, pandemic preparedness requires, our ability to develop novel tools and develop countermeasures to prevent, effective and viral disease to spread and become pandemics. So that's definitely a framework that requires, for instance, communities of nations, communities and organizations come together and build framework. Pandemic preparedness requires us to actually share data and information in real time to prevent those having disease outbreak and them to spread across. But pandemic preparedness also requires, sharing information in a way that we can use the information and allow countries that are not even in the midst of an epidemic. So I think, in the current context of Africa, that's what pandemic preparedness actually means for I don't know if that addresses the question.
Thank you very much, sir. I was able to get that. You meant that pandemic preparedness requires collaboration between countries, right? Data sharing. So from that, I want to ask that, are there ethical concerns when it comes to data sharing, especially in today's global health landscape, or should I say global and political landscape, where countries are fighting each other and all of that? Are there concerns about data sharing, maybe ethical concerns, how this data are handled? Are there concerns like that? And how can we circumvent those concerns?
I think there are ethical concerns. You don't want to share personal information. You don't want to share health information of individuals with identifiers. So I think when you share information, you have to make sure that you not necessarily expose people by providing personal identifiers so that people can be stigmatized, because that can result in stigmatization. You also want to share information in a way that is responsible. You don't want to share information and stigmatize not only individuals, but also information that will result in stigmatization of communities, not even individuals, or information in a way that can be used to stigmatize against the country, against the people. We've seen, for instance, during COVID-19, how people shared information that were very valuable for public health, but then the countries were stigmatized against. I think, there's a risk when you share data, for instance, that will result in stigmatization. But I think as a global health community, we should learn how to use data for global public good, but not to stigmatize against people. So I think there are some ethical concerns, but at least those ethical concerns can be circumvented by actually applying good practices. Applying the practices in a way that the data are actually shared for public.
Oh, thank you very much, sir. So there are things that you have put in place to actually protect this data from the public, and there are ways in which you code them so that a particular country is not stigmatized, right?
The point is that you put the data, not that you don't make the data public, but the data are made public in a way that individuals and communities cannot be used to stigmatize against. For instance, you don't want to use individual, you want to de-identify data that you're actually just making available to the public. Mm-hmm. People cannot trace a particular data to an individual. So that's where ethical issues come into. And I also mentioned the issue of stigmatization, so that people cannot use data to stigmatize against, either individuals or communities.
Okay, sir. Thank you very much, sir, for that. I know that you are the director at the Institute of Genomics and Global Health at Reedemer University, Ede. Could you share the story behind your research institute? What gap in global health did you aim to fill when you started that institute? And I understand that it has changed from ACEGID, which was Africa Center for Excellence for Genomics and Infectious Diseases. I hope I'm right on that definition, to Institute of Genomics and Global Health. Could you just share the story behind it and how it has evolved over the years, sir?
So let me first of all correct the impression that it is the African Center of Excellence for Genomics and Infectious Diseases that has evolved to become this. No. The Africa Center of Excellence for Genomics and Infectious Diseases still exists, but it exists under the Institute of Genomics and Global Health. The bigger umbrella under which you have several institutions that are several centers of excellence or centers that are involved. Among which, for instance, we're talking about the Center of International Center of Excellence in Research. You have the African Center of Excellence for Infectious Disease. You have the research, and then you also have the Center for Human Genome Research, and then also the Center of Excellence for Zoonotic Research and Disease Surveillance. These are centers that are all involved under the Institute of Genomics of Genomic and Global. So the African Center of Excellence for the Infectious Disease still exists, but under a bigger umbrella, which is the Institute of Genomics.
That's good news, sir. That means the institute has evolved over the years.
Right. It has evolved over the years.
Yes.
So again, now to get down to your question, so why did we establish and created or establishing the African Center of Excellence for the Infectious Disease? It was simply because we identify a huge gap in the space of genomics. Genomics is a new science that are creating a lot of benefit to the world in the area of precision and personalized medicine, in the region, in the area of genomic disease surveillance. But then we had to, we realized that there was a huge gap between what was happening in the global north and then Africa. And we realized that with genomic knowledge, we will actually accelerate development, not only for disease surveillance, outbreak response, but also accelerate the development of countermeasures like diagnosis, drugs, and then vaccines. So that was a reason why we actually established the African Center of Excellence for Genomics and Infectious Disease. It was actually to address that knowledge, infrastructural, and skill gap in the field of genomics. And then that has really, the establishment of this center has actually changed the trajectory of genomic research in Africa, and has given Africa awards in the competition that also help Africa to take a driver's seat when it comes to innovation in the space of genomics.
Thank you very much, sir. You're right. It has actually changed the face of genomics in Africa, because from my knowledge, you were very instrumental in sequencing the Ebola virus disease in 2014 and also in COVID-19 sequencing in 2019, which is a very good thing for West Africa. But sir, my next question is, how are you able to sustain such a cutting-edge research institute in rural Nigeria? Because from what I understand, this institute is situated in Ede in Osun State. How have you been able to cope with the landscape of Nigeria? And if there are partners that have been helping you so far, we would like to know as well, sir.
Yeah, to run this institute, it takes a lot of resources. So we've been fortunate through the work and very important work and impactful work that we do seek the support of many international organizations and then private philanthropy supporting the work that we survive many to private philanthropy, but we also shouldn't forget the fact that we are beneficiaries of the World Bank funding, and the World Bank funding is actually through a bond taken from Nigerian government to support tertiary education in Nigeria. So indirectly, the Nigerian government has also contributed to our own development and program and to sustain the effort of here. So we should be very cognizant of the time. But at least the bulk and the bulk and the majority of our funding that's supported of the funding that is supporting and sustaining this international funders and then private companies. So that's that's
all right. Thank you very much, sir. I'm also aware that you got a grant recently, which I want to congratulate you for. This is another evidence of the cutting edge technology that you are using at IGH and the importance of the work you are doing there, sir. So congratulations on that. But sir, another question I have is that genomics seems to be a very complex idea to the layman. It's like something that is so foreign, but in simple terms, sir, can you please explain what genomics is and how it is used to survey diseases?
Well, the concept of genomic appears to be very complex, maybe to a layperson, but I want to say that if we could all understand that we actually represent what genomics means, because genomics is actually the study of our DNA, of the DNA of anything that exists out there. And we understand that the science of genomics is actually just a science that is studying the genetic material that makes all of us. So then that's very, very easy to understand. Now, just to say that, because we're all made of DNA or RNA, so genomic, what it does, basically just use that DNA, the RNA that exists in different organisms, characterize that DNA, and then use that to understand better how that organisms lives, how the organisms evolve, and then how that organisms interact with their owners over time. So, and that enables you to not only to identify or better characterize an organism at the level of the nucleic acid, but it also helps you to understand how the organism over time has been growing, has been evolving. When I talk about evolving, we're talking about evolution under different things. So as time goes on, we see things like climate change, we see things like many events happening in life, and then those organisms adapt also. So study the process of adaptation of organisms, under different circumstances. With the ability to understand the genetic makeup of organisms, you understand better, and then you can actually characterize an organism better, then you therefore can actually diagnose it better. And it's because we have the ability to diagnose better that we can now use genomic as a way to do disease surveillance. Instead of doing disease surveillance based on symptoms, we now use genomic as a way to do disease surveillance based on the nucleic acid or the DNA of an organism.
Thank you so much for that very simple explanation, sir. I'm sure that the audience, either they are in science or not, would actually understand that. It's just the study of the DNA of an organism and studying it over time to see the changes that have happened in order to predict its behavior in the future. Thank you very much, sir. Yeah, that takes me to the question of SENTINEL. When I introduced you, I mentioned that you are the co-founder of SENTINEL, which is a framework to predict diseases. It's like an early warning framework to predict diseases. So I want to ask that, what inspired you to co-found SENTINEL, and how does it differ? What makes it unique from other pandemic detection frameworks?
What inspired me to co-found SENTINEL was the fact that, first of all, it was a question that when it comes to disease, so when it comes to science, when it comes to creating, to understanding diseases, what is Africa contributing to industry? God created Africa with a lot of mineral resources. What inspired us to do SENTINEL was actually to leverage the abundance of pathogens in Africa in order to actually enable the continent contribute its quota to global health development. For instance, we realized over the years that anytime there used to be an epidemic or an outbreak in Africa, the expert will come from outside Africa. They will actually just try to help Africans address their problems. Often, knowingly or unknowingly, they will probably, use. They may not understand the landscape very well, and that actually might have result. That will result in not only containing the situation, but probably potentially cases aggravating. So the reason why, for instance, Africans were not able to leverage the tools of whenever to respond to epidemics in a very precise and accurate way and fast way, simply because there was no technology on the ground, there was no innovation on the ground that will enable people to be ahead of the curve, but rather to be behind the curve. So, and then we thought about the SENTINEL that was way beyond 2014 to put in place an early warning system for epidemic response. But then we're going to be using scientific innovations to do that. And then scientific innovation, infrastructure development, and capacity building. So, and what were the scientific innovation that we were planning to use? First was actually to leverage the knowledge and skills of us to accelerate the way we can detect pathogens, to accelerate the way we can create rapid diagnosis for pathogens. But then number two was actually to also think about how we can accelerate, the data transfer. Because we realize that over time, when there's an epidemic in some village in Africa, it will take about 1 minute for that information to go from the village to the Ministry of Health, because that's where the decisions are taken. But then we thought about, using information technology and information communication technologies actually to transfer data from the most remote places to the ministries in real time. And then in so quickly, we developed what we call dashboards, and also create data capture systems that can enable somebody that is not educated or literate to capture information at a very rural level, and then that information is passed immediately to the very rural level to the top, going to, for instance, state ministries of health, going to local governments and all those. So I think that way, everybody within the network is involved. And the third thing was actually to use collect samples, and then use what I call a high-end genomic sequencing platforms. So which means using advanced technology to sequence the viruses or sequence the pathogens. Using those data that we use to sequence the pathogen to create diagnostics that somebody can use, or rapid diagnostic tests that somebody can use, or uneducated people can use in very remote areas. So in that case, we are building a system where anybody can use, can not only observe information, not only can share, but also share information. Anybody can actually become a diagnostician. So which means that you have a tool that you can actually use. Think about a test where you don't need to prick yourself. Think about a test where your saliva can actually help to diagnose multiple pathogens at the same time. Not that you have one single test per pathogen, but we multiplex this test in a way that just your saliva can enable you to detect 10 pathogens in one single drop of saliva. That information is shared in real time, for instance, with a doctor in a nearby hospital, but also with a public health officer, in the state, and then also all the way to the federal or central. So that's what we did. But then in addition to that, we also put in place a framework that helped train, people, in a way that individuals will strengthen the system, starting from rural communities all the way up to government. So in the rural communities, they will actually observe, make observation. They see changes in pattern, is the report, they can more easily diagnose by themselves. And then they can actually transfer information. So what made Sentinel unique is that actually it's a system that empowers community to actually own these frameworks. They own the framework, they become the diagnosis, and they become those that are important information. They also become the implementers, they also become those that can work with government to obtain, those local. So, and in so doing, I actually show that, through that system, there are several things that we activate in the process. We realize that if you actually report an epidemic or a disease outbreak very quickly, so that brings about the element of speed. And then you have the right diagnosis for the disease or the pathogen that's creating the outbreak. That is bringing about the aspect of accuracy. You can easily contain an outbreak. So we will basically and then you can also use tools that are cheaper. Instead of doing PCR that costs $100 of dollars, you will actually do a rapid diagnostic that will cost $2 in So we need it. So in doing Sentinel, we actually have 3 things. One is speed, second is accuracy, third is cost. We realize that when you have those 3 things, you can build an epidemic anywhere. And that's really what really important us to start building this system. And the building this system, we've shown, for instance, that we will defeat disease outbreak. Through this system, Nigeria, a country of 230 million people, defeated Ebola in 2014 with only 20 cases and 8 deaths. We've also shown that, we discovered many outbreaks even before they can actually spread. We actually detect them very early, and then also help government to contain those diseases outbreak early. So we have several use cases that I can list here: Mpox, the Marburg, and COVID-19, that we can actually use to actually illustrate the case. In the case of COVID-19, because we have sequencing facilities of highly detective sequencing facilities, we're able to detect COVID-19 and sequence the virus within 38 hours. We share that protocol with African countries, and that emboldened many African countries. And see Africa being the one discovering variants like beta variants and Omicrons, and then saw Africans taking the lead when it comes to responding to COVID-19. Now, avoiding an incredible number of deaths. So pretty much showing that this system that we actually developed and then this framework that we built actually not only in 2014, but we built that framework in 2014, but I also want to remind you that that's what the world used in 2020 to respond to COVID-19. So I think it's a system that works, the system that improves itself, and then it's a system that helps not only to that work fast and is accurate, and then they can also bring down costs. So in that way, so we've saved an incredible number of lives.
Thank you very much for that expatiated breakdown of Sentinel, sir. Now, I get that you said that it makes everybody a diagnostician. So I want to ask that, is it in form of an app, or is it in form of something that can be bought in the nearby pharmacy or in the nearby facility? How is this framework presented to the communities? And right now, AI has been incorporated into a lot of things. Is AI involved also in this framework that is Sentinel?
We recently included AI in our framework, but then let me explain to you the way it works. So first of all, we have the diagnostic tool that we use, that is talking about rapid diagnostic tests. So if you agree with me that if you gave a rapid diagnostic test to somebody in a very rural community, and he has to use his saliva, for instance, as a way to diagnose, then it's easy. And then you train the person on how to breathe. Breathing a diagnostic test, just like a pregnancy test, is very easy. You got 2 bars, it's supposed to take. 1 bar is taken. We all know that. That's a very simple way of training people. When you have a fever, then you have, okay, this is what you're going to do. Get saliva, get the test in there, and then see whether you have 2 bars or 1 bar. And then from each of the bars, we know whether it is malaria, it is typhoid, it's yellow fever, it is Lassa fever, it is Ebola, it is Marburg. We have all of those tests all put together. But then once that information is done, then remember, then you are probably empowering somebody in a rural community that's maybe like a community healthcare workers, primary healthcare official. That primary healthcare official actually has an app that enables you to capture that result. And when he captures the result, he's capturing the result not with the metadata. He enters the metadata. This person had fever for this number of days, and the person came at time. This is the GPS for his where he is, and this is a patient. And then you can add that, and then this patient has been confirmed to have Lassa fever. That information, because of the app that he has, is uploaded immediately. And then let's think about it. The district nursing officer has information, the commissioner will have information for it, the case of Nigeria, and the Minister of Health, and then we created a dashboard where people can actually see that. So you are seeing with accuracy where an event just happened. So which means that you don't have to wait until somebody's reported to the district nursing officer for it to report to somebody in the state or to the local government. The local government will report. You don't use paper. This information is done directly. But then over time, it's real-time data sharing. But when the sample actually gets to the lab, we'll also perform genomic sequencing, characterize that particular pathogens, and then we'll also share that information in real time. That characterization of the pathogen enables us, if you observe that the pathogen has changed, then we can quickly create another diagnostics that will be sent down to it. It's this feedback loop that we use actually to improve the system. But then what's good about it is that the public health decision maker has information in his brain. He can see what is happening. He knows exactly what is happening. If he sees many more cases in the next few days, then he can actually see that there's an outbreak. The community can report the fact that in the past few days we have this number of people with this same disease. Then you know that it's an outbreak, and then you can make an intervention in a way that is targeted, in a way that is precise. You are not going in suspected that you have a suspected case. You are going in there to have a case. And in cases, for instance, where we have a disease that we don't know what it's all about, all the tests fail, then those samples are sent to a lab, and then we use advanced sequencing technologies like metagenomics to identify what could be that novel organism that is creating, the outbreak. And then we have the name, we have the information, and we can easily create a diagnosis in a week or 2 maximum and send them back to the field for early detection and for easy detection. So that's the kind of system that we can build. And then with AI, we can actually start making predictions. We can use data to make predictions and then also make some forecasting. So we've also have in the system to look at climate data or many other data so that we can use that one to create, an AI model for this that can help us to make predictions that can help us to identify where is a potential hotspot for this type of disease.
Thank you, sir. The next question I want to ask is still about Sentinel, because I can see the great potential this has beyond Nigeria to Africa and even to the world. I want to ask that in how many states in Nigeria has Sentinel been operational so far? And is it also operational in Africa? And do you have plans to take it outside the shores of Africa? Or is it already operational even worldwide?
I want to say that when we started this work, we piloted it in a few states in Nigeria first. We did it in state, and then is up where we worked actually. But then with Sentinel now, with the new phase, we want to scale up and then bring in more states, but we're also working in very close collaboration with the Nigerian Center for Disease Control so that they are the ones responsible for this. And then provide information, working together with them so that we can actively across the countries wherever they are, and then use the system as a way to share information. This system is not only in Nigeria, we actually deployed the system in Sierra Leone, we also have them in Senegal. But now we want to scale up by taking it to the countries like the Democratic Republic of Congo, Rwanda, and then others. The goal for Sentinel is not just to be an African platform. It's not a plan to be an Nigerian platform. We really want it to be an early warning system that one can adopt, to have a global platform. If the framework that we created in 2014 is what the world uses to respond to COVID-19, then Sentinel can actually to respond to epidemic.
So I want to ask now that, how prepared do you think the world is for the next pandemic? Because from what I know, pandemics happen. We can't say that another pandemic will not happen after COVID-19. So how prepared do you think the world is right now?
I want to say that there's a lot of awareness about pandemic, but I'm not sure how prepared the world is. We've gone back to business as usual. After COVID-19, there were a lot of awareness and there were a lot of consciousness about the potential of disease transmission and then, nosocomial transmission disease. And then people were very much aware of the idea of protecting ourselves against the next epidemic or the next pandemic. Then the question is, are we putting in all the efforts and all the skills and all the resources that we need? So the answer says no. Have we gone back to business as usual? The answer is yes. The thing is, we're human. And then the reality is that a lot of us, after an incident is passed, we tend to forget. And then anytime there's a new occurrence, we tend to, rush and then try to address it. Are we preparing better in terms of peace now that there is no epidemic or pandemic? The answer is no. Are we working, together as it is required, coordinating, partnership, and collaboration as a global community as is needed to prepare for against the next pandemic? The answer is no. We've gone back to where countries are protecting themselves, where people are going to become very, very individualistic and protectionist. So that's why I would think that, I'm not certain that we are better prepared, but we will continue to advocate, we will continue to present, we will continue to provide the evidence that it is through collaboration, cooperation, and and oneness that we can be better prepared. Of course, we need to keep sharing information, and building the infrastructure and the capacity in all countries in order to prepare. As part of pandemic preparedness, because if we build some people, if some countries get well prepared and others not, I think it is not worth the effort. We all need to be well prepared because it takes only 24 hours or maximum 48 hours for a disease outbreak that started in a very remote place in the world to find itself in the marketplaces like New York, Paris, London, Frankfurt, and then Sydney and Tokyo and all of that. So I think, we will not be prepared as long as the weakest link in the chain is not prepared. So I think all the countries are to be at the same high level of preparedness in order for us to say that we're prepared. As long as we have some countries that are weak and not prepared, then I can tell you that we're not prepared because we can only be as good as the weakest link.
Thank you very much, sir. So I want to ask that What pathogens worry you right now? Or what could the next pandemic be? What are those, diseases that could cause a problem in the future and cross borders that people are not actually paying attention to right now from your own scientific and genomic perspective, sir?
Well, I mean, what bothers me is actually is what we don't know. The truth of what matters is that what we know, we can actually find solutions. But there are many things in nature that we don't know. And especially the fact that now man is basically just infringing with nature, man is tampering with nature. There's just a lot, that in nature that we don't know. And the question is, if a disease that is circulating, that should worry me. So there are things that are circulating in nature that we don't know and that we probably don't identify. So that's what keeps me, awake at night, because there are certainly, there's a reason why we need to do a lot of surveillance to understand what is circulating, see what is circulating, and there are things that we don't know about and we can't stand for against. That's really what I believe that we should worry about. What are those potential pathogens that are circulating that we are not aware of, that can infect humans, or that can jump from animal to human? And then therefore, that's why this is surveillance or pathogen surveillance is very important.
Sir, thank you, sir. That means a framework like Sentinel is very important in order for us to predict the coming pathogen. Even if we do not know it, we can catch it early and prevent its spread. So I also want to ask that, what can an average individual do right now in preparation for the next pandemic or to prevent any coming pandemic in the future?
We have to be very aware of what we call some basic public health issues. Can we learn things like hand washings? Can we make sure that, our basic hygiene are highly respected? Can we make sure that we report, information as we see them? Let's say, for instance, you're in an environment and then we did 2, 3 days, 5, 6, 7, 8 people also ill. And are we reporting those information to public health authorities everywhere it's supposed to be? Are we making sure that, we protect ourselves? There are some basic things. You have home, instead of staying home, you go to work or you go to school and you spread it. So there are some basic things that we're not doing. Are we washing their hands the way I'm supposed to do that? So I think, and then are we building the infrastructure, that is needed? Are we just trivializing any fever that we have that is lasting a few days and we just say it's small area? So are we trying to know what is responsible or what is giving us treatment? So those are the things that we need to, the average person should know that he is very, very responsible for the life of millions of people. So if each person is aware that, he has a responsibility of the other 7 billion people on Earth, then we are going to be very self-conscious and then also ensure that we don't protect not only us, but then the rest of the people. And that's where the name Sentinel comes from. We believe that each individual in the world should be a sentinel. That is the person that is keeping guard, the person that is watching, and somebody that should be on board. So that's the role of Sentinel. We believe that we are all sentinels.
Thank you very much, sir. I also want to ask this question. What one government policy would you advise that the government should put in place in order to help this disease surveillance thrive and people to be more aware of frameworks like Sentinel and to be able to actually take advantage of it? So what is that one policy that if you had the chance you would propose to governments everywhere to actually help prevent pandemics?
I think it's important that we, first of all, I don't think it's one single policy. I think we need to put a framework that help us to educate people at all levels of our society, but also let them realize that they have the responsibility not only for their health, but then the health of their immediate family, their community, and that they should report things when they see them, and then they should give them basic hygiene rules that people should report. Then the government should also, and I think this business shouldn't just be seen as business of government. I think the mistake we make most of the time is that we throw everything to government. We should see that we're all responsible, because the question that we should be asking, who is government? The government is all of us. So can we actually just ensure that we have the responsibility, not only for our health, but then for our neighbors' health and for our families and neighbors' health? I think we need to be self-conscious that, we should respect, basic hygiene rules. I mean, in our cases, but also what is supposed to be, and support, the government of the day, or support our communities, to report this either and then respond. I mean, cooperate with government, with public health authorities if there is a disease outbreak or if there is a public health emergency, of concern, then we should be able to work together, cooperate to respond to respond either the epidemic or the outbreak.
Thank you very much, sir. That is saying that pandemic preparedness is not just about policies or government, but it's a collective responsibility of everybody. Last year, you were named one of Time 100 most influential people, and I want to congratulate you for that, sir, for this groundbreaking work that you've been doing. That is to show that it's being seen and it is appreciated. And that is one of the reasons why I wanted you to be my first guest on this Global Health conversation, to shine the light on this. And I'm very happy that you obliged me, sir. So I want to congratulate you once again. And I want to ask that, being recognized on this global scale, how does it make you feel personally, and what does it mean for the work you do at IGH?
Well, it means that the work we do here at IGH is important, and I want to say that being named 100 most important influential people work, is a good thing, but at the same time, I want to say that it is not a singular influence. So I think I'm basically, yes, I have that conviction, but then you should know that it's a conviction of a lot of people working who have put in a lot of sacrifice, who has labored along. I think it's that group that should be recognized, and I think I'm very proud of the fact that, I am representing a team, a group of people, young, very dedicated, competent, Nigerians and Africans, who have labored over the years. So, and personally, I don't think, it's for me, it's also a simple fact that, it's an evidence that no matter where you are, if you do good work, it's going to be seen and it's going to be recognized. Being recognized among 100 most people from India, I think, is a testament that there is no hidden place for work, and if you do good work, then it will be seen.
Thank you very much, sir. And thank you also to everybody who has been supporting you at IGH, the researchers and your colleagues there. We say thank you to all of them. And that leads me to the penultimate question, sir. That is there a chance for young African scientists to actually join IGH or come for training? How are you helping to build the next researchers, the next people that will build the next Sentinel at IGH?
IGH is a very open platform, and then I will say first, Africa is made of 54 countries. We have trained people in 3 of the 54 countries, and we have trained over 3,000 Africans. So it means that IGH is a platform. It is open. Anytime we want to make training, we make calls. We also receive trainees from different countries that want their people. We make calls. We select the right set of people. We need to be very confident that when we make a call, we can't just get everybody in the room. We want to take the people that need the training, people that can actually take the training, go and impact their communities, impact their place where they work. We actually offer the training to the people that need it. So that's the reason why in the last few years we trained over 3,000 young African scientists in 3 of the 54 African countries. So clearly, IGH is open, and we are passionate about training people. We are passionate about empowering young Africans, because we believe that the future of the continent, the future of the world is in Africa. It is clear that by the years 2050, 65% of the world workforce is going to be in Africa. And it's going to be by young Africans. So this is a time to start training and preparing them. First, this is a time where we believe that Africans should start getting the skills and the necessary knowledge or the know-how to actually fit into the technologies and the platforms and the innovation tomorrow. So I think that's what IG is doing. We are not just working, they must prepare for the future. And we believe that through the skills and the knowledge that they acquire in IGH, they will be part of those that will be.
Thank you very much, sir. And now to the last question. I would love for you to help in breaking a particular myth around pandemics. Some people say they occur in cycles, 5-year cycles, 7-year cycles, 10-year cycles. From the time of the plagues in 18th century, Ebola was in 2014, COVID was in 2019. Some people say, oh, it's every 5 years. So we should be preparing for another one soon or so. So I want to ask that, are pandemics in cycles really? And if yes, which of these years is it?
Pandemics are not in cycles. That's not true. A disease that starts in a very small place somewhere, let's say in the middle of Nigeria, if government does not take care of it, if the world has already, does not take care of it, it might become a pandemic. If a disease is starting somewhere and then a government is trying its best and probably lack resources to contain, then other people should join. And we should all come together to prevent it from spreading. If we do not come together and do not bring our skills and know-how and expertise together, it will eventually spread. But if we do contain it where it is, in a very remote place, it's not going to spread. So actually, the pandemic always occurs when people are profuse either to share information, either to work together, either to provide financial or provide support, human resource support, to contain it at the beginning when it gets started. So if we don't do that, then look, these diseases do not just fly through the wind. They are carried around by human beings. These pathogens are carried around by human beings. If something started in Nigeria and then we realize that it is very dangerous, we do not close our borders. We do not share information with other people across the world. And look, we have a problem in Nigeria, and they too start putting in place, measures to test maybe people that are traveling to Nigeria, traveling from Nigeria. Then we're not actually encouraging the easy containment of that disease outbreak that's started in the country. So I think, as I said, it requires us to come together. It requires information to be shared. It requires resources to be actually used to contain. So clearly, they do not come in cycles. There are many potential pandemics that probably started in places they were contained. It didn't become pandemic. There are also potential diseases that were not be contained, in the very small places where they started, but unfortunately they were not contained and they became pandemic. So there's nothing like a cycle. I think our behaviors, our attitude toward responding to disease or to local disease outbreak actually determine whether they will become pandemic or not.
Thank you very much, sir. It's been a very enlightening and interesting discussion with you. I'm very happy that you gave me the time, for all of this. Over 40 minutes we've been talking, and I'm very glad to have spoken to you. Thank you for letting us know what pandemic preparedness actually is. If there's one thing I've taken away from this today, it's that pandemic preparedness is a duty of all of us. Each person is a sentinel, and we should be very much aware of what's happening in our environment, not only to us, to people around us, and to be able to raise the alarm when something unusual is happening as fast as possible in order for us to contain any potential pandemic. I will leave the link to ASGID and to IGH in the description of this podcast after this conversation. And I would also want to crave your indulgence because I could also come to you for another interview in future. I hope that you will indulge me, sir. So if you have questions for Professor Happi, you can send in the comment section and I'll be sure to pass it along. Maybe in the next episode or when next it comes on the podcast, we'll be able to answer those questions. Thank you so much once again for being with us today.
No problem. Thank you,
sir.
Much.
Yes, sir. Yes, sir. Yes,
Bye.
sir. Yeah, bye, sir. That feels like a perfect place to draw the curtain. Prof Happi has given us a lot to think about, from the power of genomic surveillance to the importance of global collaboration and the role of not only frontline health workers but also members of the community in keeping communities safe. That brings us to the end of today's conversation on pandemic preparedness. A huge thank you to Prof Christian Happi for such invaluable insights. If there is one takeaway from this discussion, it's that preparedness is not just about governments or scientists. It's about all of us. Whether you're a healthcare professional, a policymaker, or simply a concerned citizen, we each have a role to play in building resilience against future outbreak. You and I are sentinels. We should embody that name. To learn more about Prof Happi's work with Sentinel and his research institute, check out the links in the episode notes. And if you enjoyed this conversation, don't forget to subscribe, share this episode with, and leave us a review. It helps us reach more listeners who care about global health. Until next time, I'm Fanji, your Global Health Pharmacist, reminding you that knowledge is our best vaccine against uncertainty. Stay informed, stay prepared, and like I always say, stay healthy and God bless you. Bye!